My name is Katrina. I'm a student, registered nurse anesthetist in Minneapolis School of Anesthesia, so I'll be performing a physical exam today. And can you please let me know why you're here?
I'm having surgery on my knee.
Okay. Do you know what kind of surgery you're having?
No, it has something to do with the scope.
Okay. Any other issues you would like to address today?
I'm a little short of breath.
So when does it happen usually?
Well, I have asthma, so it's sports-induced asthma, so I just have an inhaler that I take after I work out.
Okay, sounds good. All right, well, we'll do the exam and then we'll talk about all the issues later. So, I'm gonna first take your blood pressure. I'm gonna use your right arm. I'm gonna listen to your heart as well. So for the purpose of the time, we're gonna pretend that it's the blood pressure and it's 160 over 792. I'm gonna count your respirations. The rate is 16. It's easy without difficulties, and I'm gonna check your rate. Your heart. Okay, check your pulse. Pulse is regular and it's 76. So now we're gonna go to the exam. So I'm gonna right now check your head. So I'm gonna look for masses, for any lesions, or any deformities. Everything looks good. I'm gonna ask you right now to raise your eyebrows. So I'm gonna check all your nose. Good. Can you please close your eyes? Okay, good. Can you give me a smile? Can you pop out your cheeks? Good. I'm gonna right now open your mouth. Okay, close your mouth. Can you move your jaw right to left? Good. Now in and out. Like that. That's like that. Yeah, good. Okay, so no clicking, everything, no pain at all. Okay, good. I'm gonna palpate your full lymph nodes. So I'm checking so preauricular, postauricular, occipital, submandibular, submental. I'm gonna do anterior, posterior. Okay, so I don't feel any swelling, any pain, no lymph nodes. Okay, palpable. I'm gonna ask you right now to flex your neck forward. Okay, and I'm gonna put a little bit of pressure and just go and get flexed again. So checking for your muscle strength. Good. Now extend your neck. Yep. And I'm gonna put some pressure. Okay, good. Can you rotate your neck? Yeah. Good. Any pain at all with that? Okay. I'm gonna right now ask you to bend your neck left to right. Okay. Good. So I'm gonna right now look at your thyroid. So I'm gonna ask you a little bit to tilt your back forward. So don't feel any masses. Trachea is midline. Can you swallow? Okay, I don't see any enlargements. Good. Okay, I'm gonna ask you right now to lift your shoulders up because my resistance. Good. Okay, good. Strong on both shoulders. I'll check for if you just need to move your neck left to right. And up. My resistance. Okay, good. So both sides are strong. Good. Now I'm gonna examine your eyes. I'm gonna use a pen light. First I'm gonna look at your eyes to look out for any, both eyes look symmetrical, there's no drainage, no discharge. I'm gonna look at your conjunctiva, so I'm just gonna look a little bit. Good. No drainage, no swelling. Issues. I'm right now gonna ask you to look straight at this pen and please don't move your head at all, just follow with your eyes and I'm just gonna go circling direction. directions, you just have to follow the eyes. So I'm gonna go right, upper right, low right, going left, up and down. Good. Now look, here I'm gonna go closer, follow the pen. Okay, good. So everything looks good and symmetrical. I'm gonna right now sanction some light in your eye. Checking for constriction of the pupils. So both pupils constricted, the light is good. So right now I'm gonna perform fundoscopic exam. Utilizing my fundoscope, I'm gonna dim the light, the room is dark, and I'm gonna be approaching you pretty close, so I don't want you to be scared. Okay. So I'm gonna check first your right eye, and I'm looking for the red reflex. I'm going close. Going for the red light reflex on the left eye. Sorry for shining my light. Sorry for that. So red reflex was uninterrupted, so exam finding is normal. I'm gonna examine right now your ears. So I'm just gonna look first. Outside you don't see any abnormalities, any lesions, any drainage, any skin tags. So I'm gonna palpate both pinnacles. So any masses. And I'm gonna check your tumors, and that's everything looks normal. So I'm gonna look at your each ear with my fundoscope, and we pretend it's one. So skin external looks normal. There is no lesions, no drainage. If I were to see right now your inner ear, the eardrum should be pearlish white. There is no drainage or any redness, no swelling visible. Checking your left ear right now the same way. Pulling your ear a little bit up and backwards. So it's the same. I'm right now going to perform a whisper test, and I'm going to be standing 2 feet behind you. I'm going to close one of the ear, and I'm going to tell you a few numbers on the letter, and I'm just asking you to repeat them back. So imagine we're 2 feet away, checking your right ear, and I'm going to whisper. 3, 2, 1. Can you please repeat what I said?
3, 2, 1.
Good. Now we're checking your left ear.
4, 5, 6.
Good. So they heard everything. She passed her exam. I'm gonna right now perform Weber's test. We pretend that it's my instrument, and I would assume that we would have normal findings. So it's gonna be my tuning fork. At first, I'm gonna make sure it sets on vibration. So I'm gonna set it up so it has vibration by stroke between my thumb and my index finger, and I'm gonna put in the midline of your head, and you're supposed to be feeling vibration bilaterally in both ears. And I'm right now gonna perform Green's test. So I'm using the same fork. I'm gonna be also set my fork on vibration, and I'm gonna put it on your mastoid process, and you would let me know when you start hearing the vibration, and then I would move my fork towards your ear, and you would let me know when it stopped again. And usually conductance within air is twice bigger than on your bone, and we do it on both sides. So everything, all findings are normal. I'm right now gonna inspect your nose. So I don't see any drainage. I'm gonna touch the tip of your nose to make sure there's no swelling or pain. And I'm gonna, again, with using my endoscope, I'll ask you to tilt your back backward and look each nostril. And I can see also is pink. There is no drainage. There is no septal deviation. And no normal findings. And I'm gonna also ask you to breathe in through each nostril. Good. Right and left. Good. No palpate your frontal and maxillary sinuses. So I'm gonna push and retain it all. And I'm gonna inspect right now your mouth. So looking at your lips looks pink, moist. I'm gonna ask to open your mouth, and I wish I had a spoon to suppress the mouth. So then if you open your mouth and before you stick your tongue out, just say ah. Okay, your blood is symmetrical, it goes up, so you can see the patterns of vagus nerve. And now you can open your mouth and stick out your tongue. Okay? And move it right to left. Good. Okay. Just right now keep your mouth still open. I'm just gonna look at you. So because it looks pink, tongue is pink, there's no coating. Thank you. No sore throat, obviously. Okay, don't see any redness, any swelling in your mouth. When you discharge allergens.
Hello, Mrs. Roos. Hi there. Pleasure to meet you.
Hi, nice to meet you.
We happen to have the same last name, you know. My name is John Roos. I am a student registered nurse anesthetist, and I'm going to be doing the second half of your physical examination. And so what brought you in today?
My knee, I'm having surgery on it.
And what knee is that?
My right knee,
Oh, and what's bothering you?
it hurts.
It hurts.
I
Okay.
was climbing a mountain and I fell about 200 feet and I hurt my knee pretty bad.
200 feet. You don't say. I'm a mountain climber myself.
Really?
Yeah, I've climbed Mount Kilimanjaro 3 times and Mount Everest 7 times.
Wow.
Yes,
Impressive.
yes. And what mountain were you climbing?
Everest.
Everest, you
Mhm.
don't say. Those Sherpas, I tell you what, they sure do some good work. So anyhow, you're getting a surgery, is that my understanding? And what kind of surgery are you getting?
I don't know, something with the scope.
Okay. And before we go too far, I'm just going to confirm your name, Danielle Roos. Is that correct? 1488?
Yes.
Okay, very good. Well then, shall we hop into this second half of the examination? Were there any other problems that were bothering you?
I was just saying I was a little short of breath.
Yes, that's right. I saw Miss McHenry had documented that. Shortness of breath. Exercise-induced asthma. And do you use an inhaler?
Yes.
Okay, and it's only when you're having exacerbations. Okay, you're probably going to want to take a couple puffs before your surgery in the morning just to kind of open those lungs up a little bit. Alright, so I'm going to have you face this way, please.
Standing or sitting?
Sitting is just fine. Yes, take a seat. Alright, now I'm going to have you go ahead, make yourself comfortable, relax your shoulders. You're in a safe place here. Take a nice deep breath in and out. And in and out. And I'm just going to watch you from here one more time. Nice deep breath in and out. Part of my hands and in and out. Excellent. How does your breathing feel right now?
Alright.
Good. Could I have you repeat the phrase 99 several times until you feel my hand stop touching you, please?
99, 99, 99, 99, 99.
Can you lean forward just a little bit, or sit more towards the front of your chair? That might help. Every time you feel me touch you, I want you to say the word 99.
99, 99, 99, 99, 99, 99.
Very good. I'm just going to check your lymph nodes here. And I feel no swelling or abnormal lymph nodes. Do you happen to feel any lymph nodes that feel inflamed or abnormal?
Every once once in a while, I'll have some pop up under my chin.
And what seems to cause that? Is it after an illness or is it sporadically?
It's just kind of always been there after I got tonsillitis one time.
Okay.
There's always been a few. Right now it's not so bad.
You're going to feel me tapping on your back here. First, I'm going to have you take a nice deep breath in, nice deep breath out, nice deep breath in, and when you breathe it out, I want you to hold it, okay? Breathe out. Okay, go ahead and breathe normally. I'm going to mark you right there. Take a nice few deep breaths. This time when I tell you, I'm going to have you take a deep breath in and you're going to hold it. Alright, nice deep breath in. Nice deep breath out. Nice deep breath in. Mark you right there. Grab my measuring tape here. And we have about 5.5 centimeters of diaphragmatic excursion. I'm going to go ahead and take a listen to your lungs now. Breath in and out. Just normal breaths. And in. Breath sounds are clear from the back, no wheezes, no rails. Your breathing feels okay right now? Very good, man. And I'm going to go ahead and listen to your front side now. Nice breath. And out. And in. And out. I'm going to go ahead and listen to your heart now. Do you have any cardiac history that I should be aware of?
Personally?
Personally. How about family history?
Yeah. My grandfather died of a heart attack. My dad has some heart issues.
I'm sorry to hear that. How long ago, or how old was your grandfather?
He was like in his early 60s.
Do you know if he had any other disorders associated with it? Hypertension? Was he a smoker?
Yeah, he was a smoker. And
Drinker? Okay. Well, I'm going to go ahead and take a listen here. Good, your heart sounds are good. Normal S1 and S2, no gallops or murmurs. Alright, ma'am. What I'm going to have you do, just briefly, I'm going to have you stand up. I'm going to take your chair over here. Why don't you go ahead and sit on the ground for me? Legs straight out. And if you would just splice them about 6 inches. And now I want you to see if you can turn your foot up.
Like this?
Yep. Turn it in and out and in. I'm going to have you pull up on my hands. Good. And push down. And pull up. And push down. Equal bilateral strength. And we can go ahead and sit you back in this chair. Thank you for being very cooperative. Miss, could you tell me the time?
350.
Very good. And do you know what year it is?
2015.
What month it is?
July.
July of what?
What day?
Sure.
Sunday, July. I'm on summer vacation, mister. I don't know the day.
What's your best guess?
I couldn't even tell you the 18th.
That's close enough. Alright. I'm going to have you repeat these objects back to me.
It's the 19th today.
19th. Very good. I'm going to have you repeat these objects back to me, please. Lighthouse, pencil, ball.
Lighthouse, pencil, ball.
Very good. Can you spell the word world backwards?
DLROW.
Very good. And what were those 3 objects I had you say just a moment ago?
Lighthouse, pencil, ball.
Excellent. Can you say no ifs, ands, or buts?
No ifs, ands, or buts.
Very good. I'm going to write down some instructions for you, and I want you to follow these instructions. I don't want you to read them aloud. I just want you to follow them. Could you please follow these instructions? Don't read them aloud, just do as they say.
Praise the Lord.
Excellent. Have a seat. For these tests that I'm going to do, I'm going to have you close your eyes, and we're going to be examining touch and things of that sort. So I'm going to be touching your face. When you feel me touch your face, I want you to say now. Go ahead and close your eyes. I'm just going to move your hair back slightly.
I say now.
You're going to say now, yes.
Now. 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 Now.
Very good. Now I'm just going to have you drop your hands like this with your palms up. And if you could for me, just roll up your sleeves slightly.
Both of them?
Yep. I'll have you close your eyes again. And same thing, when you feel a light touch, I want you to say now.
Now. Now. Now. Now. Now. Now. Now. Now. Now. Now.
Very good. Now I'm going to do this on your trunk. I'm just going to raise your shirt slightly, and same thing. You tell me when you feel light touch.
Now. 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 Now.
Excellent. And now we're going to do the same thing, except we're going to do it on your legs. I'll have you close your eyes. Tell me when you feel the light touch.
Now. 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 Now.
Very good. Now I'm going to do it with a bit of a sharper object. This is a painful touch. Tell me if anything seems more painful than it should be, or the other side. I'll have you close your eyes again.
Now. 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 Now.
Did this side up here seem to hurt you more?
Well, I think you pushed harder.
Oh, sorry about that. All right, I'll have you close your eyes again.
Now. Now.
Can you hold your hands like this? Very good.
Now. 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 Now.
All right, keep your eyes closed.
Now. 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 Now.
Legs out, please.
Now. 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 Now.
And we're going to do this one more time. Tell me when you feel the painful stimulus.
Now. 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 Now.
Very good. This tool is my vibrating tool.
Tuning fork?
You hear that? Very good. I'm going to have you close your eyes. Can I see this hand? I want you to tell me if you feel vibration.
Yep.
Good. Now, this hand.
Vibration.
And can I see your toe?
Vibration. Vibration.
Okay. Now, let me see your finger. I want you to close your eyes. I want you to tell me if your finger is up or down.
Down. Up. Down.
Can I see this hand? Test if your finger is up or down.
Up. Down. Down.
Good. May I see your toe? Close your eyes.
Up. Down. Up. Down. Down. Up.
Excellent. May I have you close your eyes? Hold out your hand. Keep your eyes closed. I'm going to place an object in your hand. You tell me what it is.
Key.
Very good.
A brush. Comb.
Good.
Cotton ball.
Excellent. Now I'm going to have you close your eyes again. And I'm going to write a word on your forearm. I want you to tell me what it is.
New.
Good. One more
Yes.
time. Yep, exactly. I'm going to test your reflexes here. I'm not going to hit you hard. This is just normal, alright?
No, it's not.
I'm
Does the
done.
camera see that you have a real?
Okay, close your eyes. You don't need to close your eyes, actually. That was exaggerated. We're going to check your sodium level after this. Calcium level, rather. Alright, hold your arm across your chest, just like that. Let it relax.
Why are you hitting me with the hammer?
And let your legs relax. Can I see your foot, please? Good. Now I'm going to have you stand up, ma'am. Face this direction, please. I'm going to have you put your feet together. Hands on your side. On your side. I'm going to have you close your eyes. What I'm doing is I'm assessing for sway here. Very good. You may open your eyes. I want you to put your arms straight out in front of you and close your eyes. Very good. Thank you. Now I'm going to have you take a seat. And what you're going to do is we're going to assess how quickly you can move your hands. I'll simply have you slap your thighs, pick your hands up. Slap your thighs, pick your hands up as fast as you can. On your mark, get set, go. Excellent. Now, I'm going to hold out my hand, and with the balls of your feet, I want you to tap as quickly as you can.
I'm gonna put gloves on.
Nope, tap. Very good. A little more difficult with the feet, isn't it? Alright. Now, what I'm going to have you do is I'm going to have you touch my finger. After you're done, you're going to touch your nose. Touch my finger, touch your nose. Alright? Let's start with your left arm. And now your right. Okay. Now what I'm going to have you do is you're going to touch my finger, then put your hand above your head. Touch my finger, put your hand above your head. Touch my finger, put your hand above your head. Then I'm going to have you close your eyes. Let's start with the left. Close your eyes. Good. Let's do it with the right. Close your eyes. Very good. Now I'm going to have you stand up, please, facing this way. You're going to take your right foot, and I want you to drag it from your big toe all the way up the inside of your shin and back.
Remember, this is my bad knee, though.
Yep. So we'll have you stand on this one first. Use your big toe to drag. Okay. And now can you do it on the other side?
I don't know. Can I hold on to you?
That's okay. We don't need to complete the test if it causes you physical discomfort. Please have a seat. Alright. So I'm going to have you do some walking exams. If at any time you become too painful or just unable to do that, please let me know and we can discontinue the test. Alright?
Okay.
Very good. So I'll have you stand right here. And what I'm going to have you do is just in a normal walk towards the wall, turn around and come back.
Okay. Just normal walk?
Normal walk.
Okay, let's see.
Yep. And come back. Very good. Now, once again, if this is too painful, let me know. I'm going to have you walk on your toes towards that wall and come back, walking on your toes.
I think this is too painful.
Alright, very well. Come back here. Now I'm going to have you try and walking on your heels. Once again, if it's too painful, let me know. Very good. Come back. Now I'm going to have you do heel to toe, just like you see on all the DWI movies. You haven't been drinking, have you?
Not yet.
Very good. Alright, ma'am, go ahead and have a seat. Your gait was a little abnormal, a little unequal, but that's to be expected with a bad knee.